introduce the Academy of Emergency Nursing board members, Dr. Nicholas Chmielewski, Chairperson-elect, and members at large, Ms. Denise Bayer and Dr. Andy Foley. Immediate past chairperson, Ms. Vicki Patrick, and ENA Board of Director Liaison, Chris Dellinger. I also want to thank ENA staff members, Missy Norwick and Heather Nash, for their outstanding support of the Academy Board and the Fellows. Now, let's meet the new inductees. Dr. Wesley Davis has made significant and enduring contributions to emergency nursing by forming a consortium of stakeholders and leading the development of regulatory and policy documents that address the scope of practice for emergency nurse practitioners in Wyoming. His leadership has resulted in many rural emergency departments maintaining operations that would have otherwise closed. His work now is serving as a model for replication consideration in other states. Dr. Davis is president-elect of the American Academy of Nurse Practitioners. He currently serves in multiple education and practice employment roles and actively delivers advanced nursing practice care in Wyoming. Dr. Davis is an assistant professor and dual FNP-ENP specialty coordinator for the University of South Alabama, adjunct faculty for the University of Wyoming, and emergency and acute care nurse practitioner for the Crook County Medical Services District in Sundance, Wyoming. Wesley, welcome to the Academy. Ms. Margaret Diamond. Ms. Diamond's contributions to the specialty of emergency nursing are seen through her impact on triage and certification education in Canada and internationally. She is a master trainer for the Canadian Triage and Acuity Scale and national advisor for the CTAS in Canada, and has led Canadian CTAS courses initiatives internationally. Ms. Diamond designed an online certification preparation course, shares her expertise in many peer-reviewed publications, and has been invited to be a speaker at national and international conferences. She's currently an emergency clinical nurse educator at the University of Alberta Hospital, Stollery Children's Hospital, and Manzankowski Heart Institute in Edmonton, Alberta, Canada. Margaret, welcome to the Academy, and please, we invite you to say a few words.
I want to say thank you so much to my sponsors, Carol Rush, and to Jean Harsh, and of course, the Academy of Emergency Nursing. I am deeply honored and most humbled. Thank you.
Fantastic. Thank you, Margaret. Our next inductee is Mr. Michael Frakes. Mr. Frakes' significant and enduring contributions to the specialty of emergency nursing include education and knowledge dissemination related to critical care transport and emergency critical care. He has been published in 10 books, has had more than 40 peer-reviewed journal articles, and has given more than 200 presentations for regional or national conferences since 2002. Mr. Frakes led a successful effort to make specialty certification a requirement in standards for Commission on Accreditation of Medical Transport Systems accreditation, further elevating professional practice in transport organizations internationally. He is currently a Chief Quality Officer and Director of Clinical Care for Boston MedFlight in Bedford, Massachusetts. Michael, welcome to the Academy.
Thank you so much. I particularly want to thank Jean Prell and Fred Nice for their assistance with the Academy process, but more for their mentorship really throughout my career in emergency nursing. And of course, none of this would be possible at all without the help of my family, without Melissa and Charlie and G. Volunteer activity with any organization takes time, and that time comes from somewhere else. And so I appreciate their support and what they've done for me. I am humbled to be part of the Academy with this very impressive group. Thank you very much.
Wonderful. Thank you, Michael. Our next inductee is Dr. David House. Dr. House's contributions to the specialty of emergency nursing fall in the areas of leadership, education, and practice. He was instrumental in developing and advancing the emergency nurse practitioner role through the enhancement of emergency nurse practitioner core competencies with ENA, and he helped to develop a curriculum based on core competencies and certification standards at the University of Alabama. Dr. House has influenced interprofessional collaboration through the use of a simulation model to facilitate diverse groups of health-related students as they learn the impact of interprofessional teams and that interprofessional teams have on patients. He is a founding member and lead regional director for the American Academy of Emergency Nurse Practitioners, has several peer-reviewed articles in professional journals, and is a contributing author to the Emergency Nurse Practitioner Core Curriculum book. Dr. House is an assistant professor and co-coordinator of the Emergency Nurse Practitioner subspecialty at the University of Alabama, as well as an emergency nurse practitioner at Team Health St. Vincent's Hospital System in Birmingham, Alabama. David, welcome to the Academy.
Okay, great. Thank you very much. It is indeed an honor to be part of the 2021 Academy of Emergency Nursing Fellows. I would like to thank Dr. Elda Ramirez for being my primary sponsor and Chris Geisnes as my secondary sponsor. Like a lot of people, Elda has been a mentor to me throughout my career, and even Garrett has guided me through my path, and I'm just excited to be here. And of course, looking forward to working, and, it just doesn't stop here. You just got to keep working and trying to build collaborative relationships, advocate for your patients, educate, and then mentor new leaders. And of course, I wouldn't be here if it wasn't for my wonderful wife, Hallie, and the rest of my family. Probably like a lot of you, our families are very important, and they support us, and actually a lot of times are very patient with us. So thank you again. It is indeed an honor to be a part of the Academy.
Fantastic. Welcome, David. Our next inductee is Deb Jeffries. Ms. Jeffries' significant and enduring contributions to triage education have had an impact on emergency nursing. Throughout the course of her career, her triage class was adopted across a national health system of 28 hospitals that resulted in more than 5,000 nurses taking the class. Her program included auditing processes for the purpose of inter and intra-rater reliability, a hallmark of successful triage programs recommended in the ESI manual. Ms. Jeffries has published multiple book chapters and texts on triage. She is currently an emergency department clinical educator, a clinical education specialist at Honor Health Scottsdale Osborne Medical Center in Scottsdale, Arizona, and adjunct faculty at the University of Arizona. Deb, welcome to the Academy. And if you're on the Zoom, please raise your hand.
Hi, this is Deb. Can you hear me?
Yes.
Okay, great. I also would like to thank the Academy and my sponsors, Lynn Visser and Amy Boren, for their commitment in helping me be successful in this. Like everyone else, I'd like to thank my family and my friends who were supportive through all of these years, as well as my colleagues. And if I had a moment to share with all of our emergency nurses, and even those of you that aren't emergency nurses, maybe you want to be one, because you are powerful. And we should not forget the impact that we have. No matter what comes our way, you actually do have the opportunity to change lives every single day, whether it's our patients, their families, or their colleagues. And this honor of being chosen for the Academy, I think reflects the power that we have to do just that.
Wonderful. Thank you so much, Deb, and welcome to the Academy again. Our next inductee is David McDonald. Lieutenant Commander David McDonald McDonald's contribution to the profession include leading advocacy efforts that resulted in the US Navy being the first service branch to implement the emergency nursing orientation program worldwide for all Navy emergency and trauma nurses. Lieutenant Commander McDonald developed the first certified chest pain center in the military and served as administrative leader for the first military emergency department to earn the ENA Lantern Award. He has spent the past 15 years volunteering with the Foundation for Peace in the Dominican Republic and Haiti, where he guides the practice and operation of the medical mission and planning construction of schools, churches, medical clinics, and water treatment systems. Mr. McDonald is a US Navy Lieutenant Commander, currently assigned as Chief Nursing Officer in Camp Lejeune, North Carolina. David, welcome to the Academy.
Thank you, Garrett. I am so humbled by the honor to be inducted into the Academy of Emergency Nursing. Thank you to all of my civilian, military, and ENA mentors. Specifically, I wanted to thank Gail Walker-Sello, who was my first mentor in emergency nursing and still is today. To Mary Alice Van Oy for your mentorship within the ENA and for sponsoring me to the Academy. And to my fellow Navy nurses, Captain Dan DeAurora, Captain Eric Grin, and Commander Danie Garcia Duenas for mentoring me within the Navy. I'm very proud of what we've been able to accomplish together, and I look forward to continuing to serve our community and profession through our amazing teams within the ENA, the Navy, and our joint and international colleagues around the world. Thank you again, and I'm honored to be inducted this evening.
Thank you so much, David, and thank you for your service to our country. The next inductee is Brittany Punches. Dr. Punches' significant and enduring contributions to research and emergency nursing have focused on the development of early interventions for emergency department patients. One of her most notable accomplishments as research related to early intervention is for opioid use disorder. Following this research, the University of Cincinnati Early Intervention Program incorporated addiction counseling support directly in the emergency department. Additionally, the Centers for Disease Control and Prevention's National Institute for Occupational Safety and Health, both agencies, engaged Dr. Punches to further this research to include opioid exposures and safety for first responders and emergency care workers, and to then identify programs and products to prevent toxic opioid exposure for first responders and emergency care providers. Dr. Punches is currently an assistant professor at the University of Cincinnati in the Colleges of Nursing and Medicine and associate director of the University of Cincinnati Department of Emergency Medicine, Division of Public Health and Health Services, and Early Intervention Program in Cincinnati, Ohio. Brittany, welcome to the Academy.
Hi, thank you. I'm very much honored for this achievement, and I want to thank my family and friends, especially my husband, Nick, and my 3 young children, Audrey, Edie, and Grant. And I want to thank my mentors and dissertation chairs, Dr. Kimberly Johnson and Dr. Gordon Gillespie, as well as my mentor, Dr. Michael Lyons, and Joyce Zahler, who introduced me to emergency nursing. Thank you.
Wonderful. Thank you, Brittany, and welcome again. Our next inductee is Deborah Spann. Ms. Spann's advocacy contributions to emergency nursing have been in the area of health policy and has led successful efforts for the passage of important legislation in Louisiana, including concussion awareness, motorcycle helmet requirements, advanced practice nursing oversight, hemorrhage control education and supplies in schools, and workplace violence. She is currently coordinator for the Louisiana Emergency Response Network and clinical adjunct faculty at Louisiana Tech University. Welcome, Deb, to the Academy.
So thank you for letting me have a moment to speak. I appreciate being a part of the Academy. It is a very exciting and humbling time for sure from the state of Louisiana. First of all, we spent yesterday, several emergency nurses and I spent quite a bit of time across the South where the hurricane just left devastating results. And so for all of you that have prayed for us and for those of you that have actually sent support, we can't thank you enough. So for the Academy and for the support, as I look at the names popping up on the screen, there's no way that I can thank you all. And those of you that have influenced my growth as an emergency nurse, you know how much I appreciate you, I believe. But specifically, I'd like to thank Dawn McEwen and Michael Dexter for this application. Mary LeBlond, I have to call you out by name. Sally Snow, can't miss you. Mary Jacobs' name just popped up. You guys have just been incredible to support me. And I hope I'm paying it forward and backwards. I hope I'm paying it along the way. So thank you very much. I appreciate it. And I look forward to what we'll do next.
Fantastic, Deborah. Thank you so much for your service. And we're sending all of our best wishes your way to the very hard hit part of the nation. So welcome to the Academy. Our next inductee is Lisa Tenney. Ms. Tenney's significant and enduring contributions to emergency nursing focus on advocacy efforts. She has served on the Maryland Governor's Coalition on the Nursing Shortage. Ms. Tenney was the chairperson of a group that successfully advocated for increased restrictions on the release of personal information for victims and witnesses in criminal procedures, as well as for higher penalties for crimes involving strangulation or suffocation in Maryland. Ms. Tenney's testimony regarding workplace violence to the Occupational Safety and Health Administration was so compelling that the Joint Commission used her feedback in a Sentinel event alert. She is currently a senior risk management patient safety coordinator at Holy Cross Hospital in Silver Spring, Maryland. Lisa, welcome to the Academy.
Thank you, Garrett, and thank you to the Academy for this honor. I feel humbled by listening to all the other speakers and their contributions. I would like to thank my husband and my family because they support me while I'm busy doing all the ENA activities that I do. And I'd also like to thank Richard Moreau and Rob Kramer at ENA because they are such fantastic mentors and they really help us at the state level and at the Hill. My bosses at Holy Cross Hospital couldn't be any better, as well as their education director, and we partner very well on making sure that ENA not only serves the emergency department, but our activities support the rest of the hospital and the community. And I'd like to thank the wonderful people at the Mid-Maryland chapter, especially my sponsors, Sue Sheehy and Linda Rappian, as well as the support of Pam Fox and Annabelle May, and everybody else there, as well as the wonderful nurses in the entire Maryland State Council. So thank you very much.
Thank you so much, Lisa. And again, welcome to the Academy. Our next inductee is a posthumous fellow, Ms. Joni Hentzen Daniels. Ms. Daniels is being recognized and inducted as a posthumous fellow. Her legacy lies in leadership and education contributions to emergency nursing. She had a passion for teaching and sharing knowledge with emergency nurses, and as a result, presented at local, state, and national conferences, including ENA's annual conference. She taught a CEN preparation course more than 50 times in 27 different states. Ms. Daniels was a co-investigator in an ESI study and co-authored a correlation research article in the Advanced Emergency Nursing Journal. She also brought a special, well-known sense of humor to a frequently requested ESI triage course. She has made many significant contributions to a variety of emergency nursing textbooks, journals, and online publications, and served on the editorial boards of the Journal of Emergency Nursing and the Advanced Emergency Nursing Journal. Following a 31-year career in emergency nursing, Ms. Daniels passed away on May 21st, 2016. And here to give us some words is a fellow Chris Powell. Chris?
Oh, thank you so much. I was very excited to hear that Joni had been granted induction into the fellowship in the Academy of Emergency Nursing. She was a dear friend of mine and a mentor. We grew up as ER nurses in competing hospitals across the city of Fort Worth, but we grew up together in the family of ENA. So thank you to Texas State Council for supporting and endorsing this nomination, and thank you to Joni, and on behalf of her family, her daughter Amber and son Justin, and Texas ENA and all of the ENA members and ER nurses that Joni has influenced and impacted over the years. Thank you very much.
Thank you so much, Chris, and thank you for bringing her application forward. It was just a pleasure to read the application and understand her enduring and substantial contributions that she made during her lifetime, and that continues on. Her legacy lives on, so thank you. So our last, but definitely not least, inductee into the Academy is Ms. Carolyn Jones. Carolyn Jones is an honorary fellow and our first non-nurse fellow in the Academy of Emergency Nursing. She is an award-winning filmmaker and photographer who has focused on health and nursing for the past 25 years. She has been director and executive producer of 4 healthcare-related documentaries, including Living Proof, HIV and the Pursuit of Happiness, The American Nurse, Defining Hope, and In Case of Emergency. In Case of Emergency portrays the essential and meaningful work of emergency nurses by following a select few and their patients in 7 unique settings across the US, from urban to rural settings, to shed light on some of the biggest healthcare crises facing Americans today, including the COVID-19 pandemic. The film won Best Documentary or Best Film at the Gold Coast International Film Festival, Globe Docs Film Festival, and the Chagrin Documentary Film Festival. Ms. Jones co-founded a nonprofit organization, the 100 People Foundation, to help students better understand the complex issues facing our planet and the resources we share. Carolyn, welcome to the Academy.
Oh my goodness. Well, Garrett, first of all, thank you so much. And thank you to the Academy. This is an extraordinary honor for me. And I'm extremely grateful. So first of all, I've got to thank Anne-Marie Papa and Kim Russo for sponsoring this. I think it's just so gracious and lovely of you to include me in this incredible group of people. And Nancy McCrae and Terrence Sykes, oh my goodness, you opened doors that gave me a chance to tell your story. And it's the story of America right now. I'll never forget Terrence calling me and saying, if you do this, you will see that what's going on in our country reflected in emergency departments everywhere. And so and we did, and we found that, and I'm so grateful for that experience. It has changed everyone on my team, and it's really made us devoted to getting the stories out there. And I also want to thank Patty Howard, who absolutely opened her emergency department with open arms and welcomed us in to reflect what was going on there. So a lot of brave souls that were part of this film and that made it happen. But to be able to be part of the Academy is just an extraordinary honor. And I thank you all from the bottom of my heart.
Thank you so much, Carolyn. And we very much appreciate all of your hard work and the brilliant storytelling that you weave that connects with people in an emotional and artistic way. So again, thank you so much on behalf of the Academy. Congratulations again to the 2021 Academy of Emergency Nursing class of fellows. Let's just give everybody a round of applause. Thank you all for your contributions to emergency nursing, and I look forward to your future endeavors to advance the specialty and strengthen the Academy of Emergency Nursing. I'd now like to welcome all fellows to attend the State of Academy meeting that follows immediately after at about 7 o'clock Central Time. All Academy fellows would have received an email invitation with a Zoom link. If you do not have that Zoom link, you may also find it in the events section of the Fellows community on ENA Connect. Again, on behalf of the Academy of Emergency Nursing Board of Directors and the Academy at large, welcome to all of our new inductees and congratulations.